Hi, everyone. It's Dr. Z, and welcome to another episode of Next Up Narcissism. This is not an ordinary episode. This is a special episode with one of my favorite humans, psychiatrist Dr. Jessi Gold, and she is here to talk with us all about her new book, How Do You Feel? Jessi Gold is the Chief Wellness Officer for the University of Tennessee System and an Associate Professor of Psychiatry at the University of Tennessee Health Science Center. Dr. Gold is particularly interested in college mental health, healthcare worker mental health and burnout, workplace mental health, and the overlap between pop culture, stigma, and psychiatry. She is a regular expert and freelance writer in the media on mental health, and her first book, How Do You Feel? One Doctor's Search for Humanity is officially out in October, but is available for pre-order now. Highly recommend you get it. When she's not working, she enjoys listening to Taylor Swift, watching mindless television, traveling with friends, and hanging out with her dog, Winnie, an 8-pound Maltipoo, who is absolutely adorable. This episode is going to be a little different than what we're used to. But it is absolutely something that we all can benefit from and something that I really think we all can relate to. Hi, everyone. It's Dr. Z, and welcome to another episode of Next Up Narcissism. Today, we have a very special guest and special episode. We have Dr. Jessi Gold with us, who I adore, and she just wrote a book, and we're going to talk about all the things in her book and how amazing she is and how amazing her book is and why you need to get her book.
Woohoo!
This is her book. How Do You Feel? One Doctor's Search for Humanity in Medicine. This is such a needed book, and this applies to people that are listening that are not in the field of medicine. It's really applicable to everybody because I think that people assume that somehow if you're in the medical field that you don't have any anxiety or depression or anything else. And what I always say to people is that just because you're an oncologist doesn't mean you don't get cancer. And just because you're a dentist doesn't mean you don't get cavities, period. So I'm going to throw it over to you. And I want to first ask you, why? Why was this something that you felt was necessary? Because it's a very unique approach.
Yeah, I mean, it wasn't like I was one of these people who was like, I'm going to write a book and that's the answer, right? But I think for me, I learned a lot about myself during the time period. I learned a lot about my healthcare worker patients. And then I figured out in that context how much of what I had struggled with and what they were struggling with was like a result of the training that we had and the culture that we were like indoctrinated in. And I was like, why did I learned this all? And I think I probably should like explain this to people because it is inherently the reason for so many of these issues. And like, I really want to change the culture and the way that we treat ourselves and the way that we value ourselves in the equation. And I truly believe like our stories can change culture. Like it sounds very like, yeah, like our stories, like I sound kind of like silly in that sense. And I sort of sometimes feel like I'm being like, this is like a huge goal of something, but I know it's a long-term goal. But I do think like stories can start conversation and conversation can change like a system. It just can. And there are a lot of systems at play here that do need changing.
Sure. And, this has been in place for so long. It's the culture of medicine. It's the culture of residency. It's just, it's the more overworked you are, it's almost equated with the better of a physician you're going to be. And it's quite backwards. And I think we saw this particularly during COVID, when you had frontline workers and you had people in the medical field and the mental health field that were so burnt out because not only are they, and willingly so, helping others, they're also dealing with everything that's going on in their own world with their families. And we saw such a high rate of suicide within this community, and it was really jarring. And I think personally, I don't think it got talked about enough. I heard it, you heard it, because, we hear that stuff, that's our colleagues, and we hear that kind of talk, but I don't think the general public was really aware of just how bad it was. And the culture's always been bad, but I think, and tell me if I'm wrong, that COVID really kind of brought it to the forefront.
That's all correct. So I think that there's this like general perception that we were fine, and COVID like came
We
down.
were not fine.
Right. Like COVID like came down from the fairy clouds
Yeah.
and was like, now you are bad and we will pay attention to you for this like select time period. And now that it's improved and it's not as much of an issue in hospitals in the way that it was, it's also like they must be good now, right? Like it's this belief that like sort of it was just COVID, right? And while my book is set in COVID, the reason it's set in COVID is because it was like, hello, cracks in the system, not
Yes.
because it was like, this is the problem or it's a COVID book. It's just like, that was the thing that made people stand up and pay attention.
That's right.
Like as a person who has been interested in healthcare worker mental health since I was in college, because my pre-med, like I got a master's in anthropology. I did it on pre-med as a culture.
I didn't know that.
Yeah, I did it on pre-med as a culture. So I've always been just like inherently fascinated by how we train people, why we train people this way. Yeah. And so I've paid attention to that data like way long before COVID. And a lot of people have, but we've been like saying, listen, and
this gave you a platform.
Hospital systems were like money, and we were like, but it cost you money, but it like was so intangible to them. Yeah. And then it wasn't, right? Yeah. Like obviously in a toss up of like, how do we treat all these patients with COVID, or do we help the people who are like taking care of them? They're still going to go to the COVID patients, and a lot of times like they should, but I do think it brought to the forefront that they couldn't ignore it. It was on front page news. Doctors were crying on TV, nurses were crying on TV. You saw like this kind of inescapable experience with it. And, for me, like there's not like a blessing of COVID in any means, but in mental health in general, and in particular in the populations that I treat, so healthcare workers and college students, it has made the conversation there. And we can continue it and take it, or we can tell them, oh yeah, you're right, it's better now. And I have the ability with having my book come out later to say like, no, it's not, dude, like it's not. And I'm not going to pretend it's not. And I'm going to bring back attention to this conversation, even if you think it's niche and you don't care, like it's relevant because
it's relevant because for people that are listening that are not in the medical field, you want the people treating you to be healthy. You want them to not have foggy brains. You want them, the amount of mistakes that people make, and not because they're sloppy or they're unintelligent or they don't know what they're doing, but because they're overworked and they're exhausted. And so it's not just, a physician, a nurse, a mental health provider thing. It's, even us as patients ourselves, right? We need people that are on the ball, right? So it's such a systemic issue. It's not just the providers.
Yeah, and it's not just you don't want errors and you want them to be empathetic, because both of those things matter, and patient satisfaction goes down with burned out doctors, but they leave, right? Like you need the good ones to stay. Yes. And if you live somewhere where there's one of us, like you don't want us to quit. And That's so right. It matters to you also for access. Like it just does. And like people have a hard time kind of conceptualizing how all these things relate to them.
Yeah.
Like, yes, it relates because you experience a lot of the same themes, and I'll tell you, you're going to relate to the stories because they're about perfectionism and overwork and all this stuff that are, yes, true in our professions, but also true in life, right? Like caregivers are caregivers, right? Like we're like a specific kind of caregiver, but it's not like the be all end all of caregiving. And then, but inherently, like when you have a sick family member, when your child is sick, when you are sick, you want to know that you're going to get the best care and that you have access to it. And if we don't fix this whole thing, you won't.
Correct. Plain and simple. You won't. And and you already see this happening. And I hear it from obviously the mental health end of things too, that there's no access to care. People can't get in, or there's not enough there's not enough providers in their area, and then it becomes a larger issue with insurance. It's all connected. And the other thing too, and I don't, a lot of providers, particularly those that are within the, a hospital system or something, or a VA system, the red tape is so unbelievably impossible sometimes that they leave within that respect too. I left. I was at the VA for a couple of years and I couldn't do my job. I was prevented from doing good work, and I did exactly what you said. I left. And so it is a larger issue. So for you, Dr. Gold, I'm curious kind of what kind of crises at this point, I'm going to call them, do you see happening from a mental health standpoint, and also a physical health, because our mental health and physical health obviously are one and the same. So what do you see happening within this field?
Yeah, I mean, so you mentioned the suicide thing. I mean, our rates of suicide are quite high, and especially in female physicians, and they are, inherently high because of fear of getting help and belief that getting
Because of
help
stigma?
is stigma,
Yeah.
yeah, and licensing, right? There's a lot of issues
Yeah.
around like the wording on licensing applications, which has improved some, but there's a lot of fear that like if I get help, I will lose my license and that's my entire identity. And then there's also like this fear that if I get help, I am weak, and this is an overachieving competitive crowd where you don't want to be. Like we want to all wear the same damn thing, and we're going to wear a little white coat and go on with our life, right? Like we don't want to stand out, certainly not for emotional reasons. And so, I think inherently a lot of those numbers are large because people don't get help or think that they can. And when they show up to me, because I do see this population, they're quite sick by the time that they do. And I think that that's the same thing. It's like you can kind of go two ways, and one is wait until it interferes with work, and the other is not get help, right? And both of those are worth talking about because we should be intervening a lot earlier, and the culture is not supporting that, right? And, the reasons for the issues in healthcare with burnout rates like above 50% went in, which is higher than age matched peers in similar educated fields, is that there are a lot of system problems, right? Like you mentioned, so I mean, we go into this to help people. We spend more time doing notes and talking to insurance companies. We go into this to help people. We get told we can only spend 15 minutes with them. Whatever it is, like the system is not built to support the humans who chose to get into it and why they chose to do it. And that is leading to lots of depression, anxiety, burnout. But like for sure, like all of these problems are inherently coming from a broken system. The broken culture compounds the broken system because once the system affects us, we don't get help, right? So like we are in this situation where the problems are inherently arising from our workplace because that's what burnout comes from. But if we get all these problems, but we don't even notice it's a problem because everyone else looks burnt out, and we also don't want to acknowledge it's a problem because we have fears and worries about what it means, like that culture compounds this like really bad system. And so like they kind of feed off each other in this really messed up way. And so like I tend to talk about culture some because I don't think we do. There are like a lot of things that need to be fixed in the system though, and that's inherently where this is coming from for folks. And, the system also includes the role of policymakers and people in what we do in our jobs, and the moral injury of not being able to do something that we believe is healthcare when we can't do it. There's just all of this stuff kind of like all compounds
it. It's such
it.
a helpless feeling. And then there's the guilt because you go into this field because you want to help people, and then you have these barriers to what would seem like such obvious things, right? And then, you feel horrible. I mean, you feel horrible that you can't provide the care that you know that you're capable of giving. And it seems so simple, but it's not. And I think, actually, before we even get into that, can you tell people the difference between burnout and depression? Because I think it's important for people listening to be able to identify what the difference is so they can address it before it becomes depression?
So burnout is, I like to consider it a stepping stone. So you will see a lot of data where if you're burnt out, you are more likely to be depressed and vice versa. And I think that makes sense, right? But burnout comes from the workplace. You are not just depressed because of the workplace. So if you're burnt out, sometimes being on vacation and having weekends helps. If you're super depressed, like being off for the weekend isn't going to magically make you
Correct.
better, right?
Right.
But burnout is this constellation of three things from the workplace. One being emotional exhaustion, which can just like you have nothing left at the end of the day. The second depends on who you ask, but can either be depersonalization, so very like disconnected or like numb, or cynicism, which would be very angry. And the last one is a reduced sense of personal accomplishment. Just you feel like you're not getting anything done. It might mean that you're not getting anything done, or someone's pointed out you're not getting anything done, but you feel ineffective, right? Those are the sort of constellation of things you see in burnout. And again, it's not in the diagnostic manual. It right now is a workplace associated condition defined by the WHO like that, right? We've kind of put it here because we're like, the workplace did it to you. You could make an argument for it eventually being in the diagnostic manual simply because we see people who just have burnout, but they haven't figured out a place for it yet. Depression, on the other
Well,
hand,
why do you think that is? What do you think the reason is for not including that when it's painfully obvious?
um, I think that people really want to keep like mental health conditions like separate in some way. And I've
Mm,
heard a lot of folks who are in this field be like, I don't want to confuse like burnout and depression or burnout and a mental health condition by putting it in a psychiatric manual, and saying it's a psychiatric diagnosis. But like inherently, like personality disorders are still in there, right? Like
correct.
so
Right.
like if we're gonna put these things that like we talk about in different ways as different chapters, fine, make a workplace associated chapter or something. But I'm not in charge of the DSM, but I inherently think that I have had patients where I haven't known what to code something because
Yeah.
it's not depression,
Yeah.
right?
Correct.
And then, when you think about depression, much more pervasive. There's a bigger biologic component, genetic component to it, has more to do with mood, has more to do with interest, and then obviously has a lot of like physical things like sleep, concentration, change in appetite, obviously can lead to suicidal thoughts and stuff. But keep in mind, like you mentioned, sort of the high rates in healthcare providers, burnout is a risk factor independently for suicidal thoughts. So it's not that it's part of the constellation of symptoms, but it is again sort of a stepping stone. It's a stepping stone to depression. It's a stepping stone to suicidal thoughts. It's a stepping stone to substance use and like car wrecks and all of this stuff, right? So we manage burnout like it's, oh, like the workplace did that to you and work was hard, right? But it is like so much more than that.
So
And it
much
is
more.
so pervasive and it really affects people's lives. And we don't notice it until we're pretty bad because our workplaces in American culture are inherently built on us working so much that we think that we're supposed to feel like that. Like, if I'm good at my job, I will be emotionally exhausted. If I'm good at my job, I will be tired, right? Like, all of those things are true. And so when we start to be like, well, is this a problem? We go, no, 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 no. Like, I'm just good at my job, right? Like, this
Well,
is what
that's
you
what I was gonna
do.
say. How do people even begin to notice that they're even dealing with that? Because you're right. If you are worked to the bone, if you are so stressed and overwhelmed, it's almost viewed as you're good at your job or you're a go-getter or. So I mean, there's a certain point for me even where if I have X number of patients and then it goes even one over that, I feel it. And I don't like how I feel, but yet, does that mean that I'm working harder? I think maybe because I can see it a little bit more because I pay attention to it. But for people that maybe their personality is such that they are perfectionistic and they don't like saying no, people pleasers. I mean, all of those types of personality styles are at risk for, obviously burning out and things like that. But what do you think it is, aside from this idea of the more you do, the better you are, whether that's motherhood, whether that's being a psychiatrist, it doesn't matter. The more you do, the better. Why do we have such a hard time acknowledging before it gets to that place where we tip?
It's like one thing is it's normalized. Like we look around and everyone looks like that, especially in healthcare. But like in the American workplace, we can look around and we can say, I think I'm supposed to just be like this because I'm better than that person or I'm equal to that person. So I'm good. And then within that same measurement, we go, if I'm not, something's
Something's
wrong with me.
inherently wrong with me.
Yeah,
Right.
like something's wrong with me. And so it becomes that instead of like, oh, this is inherently a problem. We should all not feel like this. We are allowed to feel like this, like give yourself space for it. And so within that context, like, for me, for example, like I was falling asleep and not knowing I went to sleep in front of the TV before I noticed something was wrong. And that is what happens because you go, little bits are okay until it's not okay. And then you're like, oh, and me, I went right towards it's a physical illness, fix the physical illness,
Yes.
right? But
Yes.
I think that it's easy to miss in like a normalized bad, right? Like we have a normalized bad work environment. And so we basically convince ourselves we're fine.
Yeah. Yeah. And rather than notice the small signs, we wait until you're 100% what, like, I mean, once I get a migraine, I'm like, oh, it's kind of like there was probably a million steps before that I could have adjusted things so that it didn't affect my physical health. So for people listening who, regardless of what field they're in, what do you tell people? What are some kind of, it's not this easy, but what are some coping skills that people can use or things you reference in your book that are beneficial that people can kind of have a checklist that they go through?
Yeah. So the book is called How Do You Feel for a Reason. So, inherently we're bad at asking that. And because we don't ask that, we don't notice subtle changes and we don't notice until we're really bad. So, like, tip one, as silly and simple as it sounds, check in on you. Like, what burnout looks like in you or what these things look like in you might be different. Like, for me, email anger is like a primary early sign, right? I want to throw my computer out the window because somebody asked me something to do in an email, right? Like, why does this keep going up? I think I deleted them all 10 minutes ago. What is going on, right? And that feeling is like out of proportion to the situation, but is also not so bad that I'm like, ooh, like warning sign, warning sign. But now I know it is. And at that point, you can do a skill that is not going to make you mad. So if you're a 10 out of 10 burnt out and I told you to deep breathe, you'd also punch me in the face. And so at 2, maybe you would be okay with it, right? So what coping skills you can do based on how bad you are is relevant, which is why asking yourself how you're doing matters, because you can actually intervene differently and you don't just need to quit or go on vacation. And then I would say, across the board, meaning and purpose are protective against burnout. It sounds super woo-woo and strange, like, hey, like what's meaning and what's purpose? But really it just means like you chose to do this for a reason. And it's really easy to lose that in the context of systems and things that are interfering with what you're doing. How do you ground in that? Sometimes it's just reminding yourself in some way. Sometimes it's making sure that you're not saying no to the activities that are actually the things you get meaning and purpose from. So sometimes we look at our to-do list, someone asks us to do something and we're like, nah, we can't do that. I have too much going on. But that thing was a social event, or that thing was mentoring, and that thing was something that you actually liked, but you just were like, I don't have capacity for more. And inherently there's truth in that, right? And I think that truth is like the part that we need to pay attention to. Like we need to go, yes, I really feel like I don't have capacity, but this will give me back energy and I need to do it. And so meaning and purpose are big in the context of boundaries, which I'm sure you talk about all the time, but boundaries are relevant. Saying no is relevant, but also being sure that you're saying no only to the things that you really don't have emotional capacity for or aren't helping you. And then the third
distinction is so important. It's so important that, yes, I love that. Love it.
And then the last thing I would say is social support. So like, again, preventative across the board in workplaces. So when I say that, I don't mean you have like 1,000 friends. I mean, you have like someone that you could be open and honest and vulnerable with about this stuff, because otherwise you feel alone. If you look across the room and everyone looks burnt out, you say, I'm burnt out, and that's bad, right? So you have to have somebody that you go, it's kind of weird that like we get 1,000 emails a day, right? Like, something where you at least can like test the waters and see if they tolerate it and how they respond and do they make you smile or do they understand it? Like, that is enough to make you feel seen and understood. That's why therapy helps too, as like a separate sort of sidebar to not a friend, right? Like, I go to therapy every week, I take meds. These things have helped me substantially, but they're not the only things. And you can do things. And I think it's important that, especially in things with burnout, you find ways to have control, because control is really important. And it can feel like these systems will never change, and they might not. Right. And so inherently, as much as I hate like telling you things to do for you in a broken system, if you would like to stay in your job, which I'd like most of you probably listening to stay in your job, like if I would like you to stay in your job, you have to figure out how to make your job feasible. And that means you have to find this stuff. And I'm not saying it's you're the problem, like in a Taylor Swift reference kind of way, but in so many ways, like, we do need to have some ownership of where we can have ownership, or we will feel lost in a very complex, interwoven, probably never going to change, at least for not years, storm,
That is so well said. I don't think I could put that any better. That is so beautifully said. And you're right. You have to look for the things that you have control over, even if it's something so unbelievably small, but just feeling that ability to take something, take ownership of it, and just hold it as your own is so important. Otherwise, you get lost in this massive system that it's bigger than you. But to your point about social support, I always ask people when they come to me, what's your goal, right? And they'll always say, I want to be happier. And I'm like, cool, me too. But mood is never a goal, right? Because mood's a moving target. I could be fine one day and then, I wake up and I don't know, I feel like crap. And then the rest of my day is shot, let's say. So mood is never the goal, but living a fulfilled life is. And that's really what I think you're hitting on, is that you're going to have these moods. You're going to have burnout. You're going to have depression, possibly. You're going to have anxiety, possibly, right? Like, I take meds for anxiety. It's part of managing life, I find, like, it's part of managing that day to day. And so I think people forget that the goal should not be a mood. The goal should be, are you engaging in behaviors that you value? Are you engaging in behaviors that you feel fulfilled with? Which means maybe saying no to some things and saying yes to the things that you find fulfilling. The other thing I tell people is that when you're anxious, when you're depressed, when you're burnt out, you feel alone, because the culture doesn't promote this open conversation, right? Like, you and I could talk about it openly. Fine, great, but that's because that's our field. And I think, based on the field, particularly in medicine, like you said, it's very hush hush, and it's unfortunate. But I want people listening to understand that I promise you, I promise you that the majority of the people feel the same way you do. I would be shocked if you were even remotely close to the minority.
But it so much makes you feel like it just feels so crummy. And like, I'm a big fan of vulnerability. It's hard to be vulnerable. All of the words in the definition of vulnerable are yucky, like uncertainty, emotional exposure, and risk. It's like, sign me up for the worst possible things you could think of. But inherently, like, it makes such a big difference. Like, and I don't mean everybody has to do what you and I just did, which was say we take meds and stuff. Like, it is important in where we've gotten in our careers, in the things that we care about and what we do, that we feel comfortable sharing the parts of our story that we share, because I think it makes a difference in moving the conversation in the field in a broader way forward. But for the most part, when we say be vulnerable, we mean like, say some of the quiet stuff out loud, right? Like, when you come into work tired, say, sometimes work life is hard to balance. I'm tired today. You will affect somebody who's a colleague, who's younger than you, in a way that you can't even understand by simply saying that. Like, every single healthcare worker that I talked to mentioned codes as the time that they learned about emotion, because they were sitting there, somebody died or didn't die, but they did this whole thing, right, to try to resuscitate them, and nobody reacted. And they're 22 in med school, and they go, I guess that's what you do if you're good at this. You don't react. And so they learn not to feel because nobody around them says anything and feels anything. If one person in that room said, what was this experience like for you? Or I remember my first code. I felt like this. What was it like for you? Or let's have some time to just like take a break because that was a lot. Or before you went to lunch right after, or even if you still had to go to lunch right after, you said, going to lunch after that is weird, isn't it? Right? Like these things that we just don't say could make the difference between like that student remaining themselves for the rest of their career or feeling they belong for the rest of their career. And it could really, I mean, I'm telling you, it's like this big hoity-toity, like big things, but yeah, nothing.
I remember this. You just made me remember this. When I worked at the VA hospital, I was the psychologist on the hospice unit, and I vividly remember I'd always worked within like physical health, and so I had patients that passed away from physical, from cancer and from heart attacks, things like that. When I was on the hospice unit, and my first patient died, I was an absolute disaster. And I don't know why, because I had worked with people prior to that who had passed away. But there was something about, maybe it was the unit, I don't know what it was, but for whatever reason, I just absolutely lost it. I was a mess for like a couple of days. Not one person brought it up as a thing. And it's because, they see this every day, right? And obviously over time, I didn't respond like that, but I'm telling you, had somebody said to me, yes, this is normal, this is okay, like this is the first time you've dealt with this, and it would have been such an not easier experience, but such a, I don't know, different type of experience, right? Like it's something to talk about, and it's just, you bring it up in status meeting, so-and-so died, next. And it was really upsetting. I mean, this is a human being that had a life, and and I just remember that, and it was a really difficult thing to sit through. It was horrible. It felt horrible. It just felt horrible. And I know part of it is that you can move on and do your job, but you can still move on and do your job and process these things. They're not going to slow you down. If anything, it's going to make you more effective as a provider.
Yeah. And I think that I feel very similarly about asking for help and getting therapy and all that. Like we view it very much like I have problem, I fix problem. That's the only time I go, I have something that needs fixing. And I've always viewed it like, man, am I better at my job because I have that?
Yes.
And I think it's the same thing. Like if you step away and step back, if you do something for yourself and step back, if you're a mom and you feel like you have no time and you take 5 minutes for you, you are better in those situations that you thought you shouldn't have stepped away from. And it is a whole mindset to change, and it is hard. Do not get me wrong on that. However, like if you can change it sometimes, you will feel so much better,
Mm-hmm. What do you tell people to do with the shame and guilt they feel when they do that?
Give yourself space and time.
Friends.
No, like give yourself space and time for it, because I think it's valid, right? Like inherently the shame and guilt is coming from a place of wanting to be all things to all people and thinking you can be, and that's okay. And I think there's a lot of self-compassion that comes into play there, right? Like we wouldn't talk to a friend in the so many ways that we talk to ourselves. And if you try to hear any of that out loud, maybe you would hear it and say like, ooh, I shouldn't have done that. Like if you told me like, I'm really guilty that I can't go to this and I'm taking care because of taking care of my kids or whatever, I would be like, well, that's fair. You have kids. That makes sense. And you'd be like, no, it's because I'm a horrible friend and a horrible mom, right? Like that's what you would say. Like if I had said that to you,
do you know how many times a day that thought of I'm a horrible mom comes through my head? Honest to God.
Probably way too many for how much of a good mom I know that you actually are.
Oh, thanks. I think I'm the crappiest mom on a daily basis.
But inherently, it's like if a friend, like if you told me that and my response to you was like, yeah, because you're a horrible mother, you would literally never want to talk to me for advice again, if not at all, right? And that is just not what we choose friends for. And we shouldn't choose ourselves for that reason either. Like we should try. It's hard to do. You might not catch it all the time, but if you could catch it like once or twice, like self-compassion in these situations is totally huge.
Mm-hmm. Well, then you give yourself space to just feel all the things. And, and again, the biggest thing I cannot stress enough is that nobody is alone in this. And the reason why we feel so alone is because there's this expectation that, as Dr. Gold's been talking about, that we just shouldn't talk about it. It makes us weaker. It makes us worse at our job. And, and it's just has no place. It doesn't fit anywhere, has no place. Do it on your own time, but don't bring it here. And you can't selectively choose, what you think or feel in any given moment. And therefore all of it should be addressed. And I stand by that. I know you clearly do. So, okay. For those of you listening, tell us where we can buy your amazing book. How do you feel?
How do you feel? You can get it at all of the places that you can get books. You can look up How Do You Feel, Jessi Gold. I spell it Jessi and find it most places. You can find it on Amazon. You can find it on Bookshop. You can find it on Barnes & Noble. You can find it in Books A Million. You can go to your local bookstore and support it and support me in the same way. I hope you consider getting it. I hope you consider getting it for a friend that you want to have the conversation with, like a healthcare worker, your therapist, whatever it is, your mentee, someone who likes Taylor Swift. There's a lot of Taylor Swift things in there. I had to cut them down because I was afraid it was getting weird.
Jessi's a huge Taylor Swift fan.
It was getting weird, and people were like, maybe you shouldn't do that. But
she should get your book. That should be our goal.
If you can ever find a way to Taylor Swift, I would never complain.
And then you are coming to Philly for those
in
of you
December.
That are local in December, and her and I
on the 9th at Main Point Books.
Yes.
Me and you will be talking about all things this and how we hate all coping skills. Just kidding, but it probably will be part of it.
We hate coping skills. We know we need them, but we don't like them.
They are totally all coping skills.
Yes. Awesome. This was so great. And Instagram, where are you on Instagram?
At Dr. Jessi Gold.
With an I.
Yeah.
Yes. Or I, just I, sorry.
Jessi, like Jessica without the CA.
I like that.
Because that's where it came from.
I like that. Awesome. Okay. Well, thank you so much. And I will post all the links, everything in the show notes for people listening. And thank you so much for coming on. I always love talking to you.
Thanks for having me, friend.
Bye. Thank you for tuning in to another episode of Next Up Narcissism. I hope you found it useful, but most importantly, I hope you found it validating. Want to work one-on-one with me? Visit my website at drjamiezuckerman.com to book a personalized coaching session, and be sure to check out my on-demand workshops on topics like co-parenting with a narcissist, life after leaving, anxiety management strategies, and more. Again, that's drjamiezuckerman.com. You'll also find links to my interactive workbooks, merchandise, resources, and newsletter sign-up. Next Up Narcissism is as much your podcast as it is mine. I want to hear your feedback and what you want to hear. So make sure to leave a podcast review wherever you listen, or send an email to nextup@drjamiezuckerman.com. Again, that's nextup@drjamiezuckerman.com. Be sure to subscribe so that you never miss an episode. And as always, thank you so much for listening. Make sure to tune in next week to see what's up next on Next Up Narcissism.